So today's presentation is titled Building and Sustaining Best Practices. It is a great pleasure that I introduce you to our speaker for today. Our speaker for today is Jennifer Chan. Jennifer started her nursing journey in 2015 as an ICU nurse. Around 2018, while Jennifer was in her third year of the ICU at Humber River Hospital, Humber River Hospital began its BPSO journey. In late 2019, Jennifer moved into her leadership role at Humber River Hospital as a clinical practice leader, COVID manager, and now as the BPSO clinical lead. Jennifer uses her clinical and leadership experience to create staff engagement, implement quality improvement, and build on working with external networks while creating a safe culture for staff and patients at Humber River Hospital. When Jennifer is not at Humber River Hospital, she's an avid competitive swimmer and loves spending time tasting her fiance's dishes. So welcome, Jen.
Hi, everyone. Sorry, I forgot to unmute myself. So thank you, Patricia, and thank you, RNAO, and everyone here to attend this presentation. The whole goal of this presentation is just to share my experience as a best practice clinical lead, and also to share Humber River Hospital's journey in sustaining implementations of best practices. Also, the key objective is incorporating BPSO or best practices within our practice at any organization. It's very streamless and very easy to sustain any other implementation when you implement in the future. So some background about Humber River Hospital, our journey. Like Patricia said, BPSO is Best Practice Spotlight Organization. So think of it as a formal contract that Humber River Hospital joined with RNAO to meet certain deliverables. So we started this journey in 2018. Then in 2019, the pandemic hit. So everyone is familiar with the pandemic, COVID, where there's changes in priorities. And then with changes in priorities, there's a lot of turnover rates for nursing staff and healthcare professionals. And with turnover rates, there was less engagement and less awareness of BPSO, or what BPSO stand for, or what champion was for BPSO. So then in 2021, Humber River Hospital officially became the BPSO designate. They officially have the title. And I also became the second BPSO clinical lead at Humber River Hospital. So learning a whole new role and also trying to get the understanding of what BPSO is due to the pandemic. It's important to understand or determine organization readiness or needs or staff needs. And organization readiness, staff needs always shifts. So last year it could be a different need. This year it's different. So understanding right now what can support the staff, what does the organization need, and is it ready to make this any quality of improvement or implementing any best practice? Is the organization ready? Also, to help with understanding organization readiness and needs, performing a gap analysis. So there's two types that I did. There was the knowledge, understanding if there's a knowledge gap. So conducting surveys, determining current staff, if they understand what BPSO meant, what BPG were implemented in the past, were they aware of them, and future best practice guidelines. And then performing a system review or a system gap analysis. So at Humber River Hospital, we use Meditech as our electronic medical records. So are these best practice guidelines, are they implemented in Meditech? Are there policies already there in place? Are there any electronic auditing systems? So doing an environmental scan was also important to determine organization readiness. And then when doing these gap analysis, establishing a team of experts is very useful because it's collaborative work. You have experts, team members, shared work, and shared vision. And what we came up with after doing all of this was an implementation of the first BPSO workshop to help address these gaps. And in this presentation, I'm going to go through in detail what I just went through. So establishing a structure. So we're going to go back to realigning, understanding organization needs by understanding the strategic plan of an organization. So Humber River Hospital's goal was always to become or continue to become a high reliable hospital, continue with the quadruple aim. So understand the benefits of BPSO in that aspect is very useful to educate with and share with stakeholders, share with end users. So it also standardized care with evidence. BPSO or best practice guidelines will reduce variability and also provide gap analysis that are always current and routine. And this is another point to becoming a BPSO or a beneficial is to build capacity for Humber River Hospital staff in leadership and fellowship opportunities. And also we're going through accreditation next year. And so this BPSO also aligns with Accreditation Canada. This is just an overview and it's shared with our team just to make sure that everyone's on the same page of how BPSO and the structure of each member can work to build this BPSO implementation. So the first at the top here is the BPSO clinical lead. Myself, I talk to external stakeholders like RNAO. We discuss deliverables that needs to be met or updates. And then we go back at Humber River Hospital, and each of those best practice guidelines, there is the team of experts. So a team of experts were created. I'm going to use pressure injury best practice guidelines as an example. So the pressure injury, a team of experts were created. It consists of NPs, PTs, dietitian, nurse educators, a lot of members that are expert in that field. And we conduct the gap analysis, so the system gap, the knowledge gap, and then we determine, okay, what implementation can we do to solve these gaps? So the implementation was the BPSO workshop. Once we came up with the plan, we then facilitate down to the other CPLs and managers on the other floors who would implement it with their champions on that floor. And then monthly audits are also conducted because with every implementation, there should be an evaluation process. So that monthly audits were reviewed by the committee of experts on a monthly basis and also shared. So high-level key concepts were shared with the CPLs and managers on the unit. And then a quarterly is shared with the end users or the champions on the unit. Also on a monthly basis is shared with senior team. So everyone is connected and working together. So going back to the example of the pressure injury best practice guideline implementation, so that knowledge gap review. So what we did was we created a little in-service. So on the left here, you see a little pamphlet. It's a little pamphlet that we use for in-service on the unit. It takes about 15 minutes. But before the in-service, we do a questionnaire. So on the right, you see the questionnaire. The questionnaire is done before the mini in-service, and then it's done after to see if there's any knowledge retention. Then for the system review, what we did was we conducted we try to find out where the current documentation for pressure injury is located. And you can see here, it's located in multiple places, multiple areas. And then if there's policies and if there's an auditing system for this pressure injury best practice guideline implementation. And there were, because there are different documents, so different teams were using we're trying to audit on pressure injury, but there are different documentation location, and different auditing reports that were pulling. So there were knowledge gap and system gaps. So bringing it, I'm sorry, I'm gonna mute myself for the overhead page. Sorry about that. So bringing both what we found back to the team of experts. Sorry. What we found was for that knowledge. So after that pre and post questionnaire, after the in-service, here you see this is the same questionnaire. Each column identifies the question that belongs to the questionnaire. Blue indicates pre-test. Orange indicates post-test after the in-service. And you see each question, there's a drastic increase in knowledge retention. So right there was a knowledge gap. Then for the system review, so like I mentioned, there were multiple locations where pressure injury was located. Also, with every best practice guidelines, there's always a risk assessment done on admission. So there was no, on admission, there were multiple locations where a nurse would have to document. It's not in one documentation for admission. So what we did was we standardized this documentation system specifically on admission. So we took the other best practice guideline that we implemented, so pressure injury, falls, and pain, as you can see here. They have a risk assessment. We combine them into one admission documentation with the head-to-toe assessment, every other documentation that's required for the frontline nurse to document. And you can see that the blue indicates pre-implementation of this admission documentation, and orange indicates post-implementation results. And you see each best practice guidelines, there are improvements. Falls has a slight improvement because Falls only had one location to document. However, it was not put in the admission documentation. So when we put it into the admission documentation, there is an improvement. And then how did we transfer all of this, what we found, to our CPLs, managers? CPL means nurse educators, so, or clinical practice leaders. So how do we transfer this information to our CPLs, managers, senior leaders, and our frontline staff, our champions? So there's a newsletter. The newsletter has a front and back. The newsletter is done every other month or quarterly because we don't want to bombard them with too much information. And at the beginning, at the top, you have events. So champion events or BPSO events that will cause engagement, increase engagement of staff. Then we have at the bottom also projects that we've done. So that helps with champions seeing that they do matter, they do some work, and that there's future work that's being done that they can be involved in. So we talked about the admission assessment. Later on, I'll mention briefly about the other two projects we're working on. And then on the back, there's also linking it with RNAO, the events. So on RNAO, every month they have events for webinars such as this one. So also including that in the newsletter. And I found it very useful that it's on a newsletter so that those are interested, they would message me and I register them, and it's easy to track those that are interested. So building capacity is another part of the deliverable for being a BPSO. And because of COVID-19, it was very difficult because of decreased engagement, increased turnover, decreased awareness of BPSO. And then that's where you got the gap analysis and the system gaps that we want to teach what we've learned about what we saw about the gap and system gaps. So the BPSO workshop was created. This is the newsletter that was created for the BPSO workshop. And the workshop was in May 2022. And there were barriers in creating this workshop. Like I said, it was COVID-19. Our team of experts, it was great to have because they were, the fact that we shared the same vision and objective, there were a few of us, so we could take turns teaching these topics. Each topics, there were 6 best practice guidelines that we taught, and each topic was interactive and it has a theory content. So working together, trying to do more audits, more system review, more knowledge gap to actually determine what we're teaching, because that's important, because the BPSO workshop was catered to current nursing staff or current healthcare professionals, not the incoming. So the current healthcare professionals already know how to document on Meditech. They already know what to document, but understanding why we're doing it, understanding the purpose of why we have to properly document, that was the goal of the BPSO workshop. So it took a while until May 2022, the actual workshop started. We created a lot of awareness of flyers and videos, which I'm going to show you on the workshop and on BPSO itself. And then after the workshop, we have evaluation surveys. It's important that we collect the surveys because we want to monitor and also change the BPSO workshop every year to maintain that support, that need of our organization and our staff. So this is our video. And that is it. So these are QR codes that if you scan, it goes to our external website. If you scan in this one, it shows you the actual flyer that I showed you at the beginning. And to tie it all back, when it comes to champion capacity, how I view it is I use this knowledge to this is from RNAO, knowledge to action framework. And what's very important is that change behavior. What I find is this knowledge to action is very easy once you get motivation champions and have that change behavior. So all of my initiatives for champion capacity or awareness or building engagement is using this wave, this wave part. And how I did that was that wave really talked about precondition, what motivates healthcare professional or what motivates a staff to get involved, to making a difference. So at Humber River Hospital, we have a new staff orientation. All staff goes to this orientation. It's 8 days for clinical staff, and it's 4 days for non-clinical staff. But all the staff will go through the BPSO presentation, which is done by myself. And during the presentation, they get to do the survey that's you see here on the left. And the survey really asked about, the first question asked about their knowledge, or their understanding of what BPSO is. Have they heard about BPSO? Have they heard about Champion? Again, trying to understand if there's a knowledge gap coming into the organization. And you're not going to be surprised. Usually almost 100% would say they don't know what BPSO is. So they would say a lot of no's. And then later into the presentation or orientation, they scan a QR code and they do a word map. And in that word map, it really asks them because they're new staff, so they should remember why they applied to Humber River Hospital, what motivates them, intrinsic factors and extrinsic factors. And once they do this word map, it ties into why they potentially want to become a champion. And then afterwards, after the presentation, I asked, are they more aware? Majority said, 100% says yes. And then the most important question is, would you want to join the best practice champion? And this on the top is one of our intake. We do the intake every month. So this is one of the months. And not surprising, I've never seen a score lower than 75%. It's always 75% higher that wants to be a champion once they understand what BPSO and champion really means for an organization. And also, I work collaboratively with human resources as well. All the new staff, when they answer this question, I get a list of their names, and beside their names, they'll get this answer, either yes or no, they want to be a champion. That list gets sent to their managers and CPLs. And that is how we build capacity for champions for right off of onboarding. So when a next event, a next BPSO training or next BPSO workshop, CPLs and managers on the unit already have a list of potential names that wants to be involved. So this is continuation of the 8-day new staff orientation. Another important factor for me, or what I've learned, is that dissemination, just combining it with other initiatives within Humber River Hospital or within your organization. Try to link it up with as many initiatives or projects are out there, because BPSO or best practice is linked to almost everything when it comes to healthcare. So for example, the 8-day orientation has multiple topics, and those topics align with our best practice guidelines. So topics about pain, topics about falls, prevention, pressure injury. So during those 8 days, they get this questionnaire and they're supposed to answer it every time a presenter presents and they see this logo. And the presenter will ask, please refer to your questionnaire and answer this question on your questionnaire. At the end of the 8th day, it's submitted, we mark it, and it's a little friendly competition. They get a prize for those that get 100%. So it keeps them motivated, involved, and also understand that BPSO is linked to throughout Humber River Hospital. Other ways to communicate with champions is I mentioned the newsletter. The newsletter was it's emailed to all of our champions and also printed out for managers and CPLs on the unit. And they use that for huddles. After the huddle, they post it on a communication board. And that's how it's proof for education, and also it helps with accreditation. Then we also have a iHumber page. It's for our intranet website where champions, any healthcare Humber River Hospital staff can access. We have a Twitter, which is up here. And then we also have an external website as well. And that external website is mostly for family members and patients to understand what BPSO is. And this is just a picture of our internal website, our iHumber page. And that QR code is the same. If you scan it, it goes to that video that was shared. So implementation and dissemination of BPSO. And this is how, it's kind of like my favorite topic, is because it really helps you link everything together and combine it and work it with other teams. And it's like an everyday practice. So for example, BPSO status board was created to help with safety huddles. So almost every day on the unit conducts a safety huddle with their staff, frontline staff. And in the safety huddle, they ask a few questions relating to, you see here in this blue square. So CCRT is our rapid response team. Any patient that's being followed by CCRT, they're in critical condition. They might need to be transferred to ICU. Then there's also questions on if the patient has a risk of falling, do they have a pressure injury, are they delirious, are they palliative, and are they ready to be discharged, yes or no. So before the BPSO status board, this was done verbally, and we've already documented this in Meditech, but it's everywhere in Meditech. It's not pulled within one screen. With the BPSO status board at the bottom here, that's a picture of what it looks like. If this is a test patient, it pulls up all the patients at once, and at the top column where it's yellow highlighted, it aligns with the questions that's being asked, and it's live. This is all live documentation, so it's easy access and provides more time for patient quality care. Other initiatives that champions and BPSO is involved in to make it disseminated within Humber River Hospital. We talked about the admission assessment, but we also did the post-fall clinical panel. So after fall, there's a lot of a lot of assessments and documentation that's required. Sometimes it's missed, or sometimes it's not done it's done later on, and there's no trending. We can't see the trend. So the clinical panel, as you see here, this big screen, this big screenshot, on the left, it's all the documentation that's required, an assessment that's required after fall. It shows a trend, and it also pulls doctor's notes as well relating to that fall. Our next project is to help team leaders with audits, or our resource nurses on the floor. They always have to do audits, but is there a way, and these audits are all linking to best practice now, like pressure injury audits, CVAT, IV audits. So we want to make a way to have an electronic report so that the team leaders have more time to support the unit, and the audit is an automatic electronic report that's easy accessible. And this is just the creation of the committee. So the committee it's just a picture of some of the members, champions for our committee. Another useful thing is, after all the presentation about BPSO and champion, still some champions after training, they're still worried about taking the first initiative taking the first step to do an initiative. They prefer to work as a team, as a group. And CPLs and managers might not understand what champions are able to do. So creating a role description for champions for CPLs and manager is very useful. This is actually posted on our intranet website for our managers to use, so that they can see that if they're creating a small initiative just within their unit, here are the champions that they have, and this is how they can get them involved in that in that initiative. And then with every implementation, it's important for evaluation, and that helps with sustainability. And how we sustain our best practices right now is we do the monthly audits all the time. And even if there's a best practice guideline that was done a couple of years ago, we still try to meet on a quarterly basis or at least twice a year, just to make sure that there's no new updates, no new revisions that needs to be made. Also, we can now, the BPSO workshop was such a great hit. It's now an annual thing, and that BPSO workshop always change each year so that it supports the organization and the staff needs. We also created partnership and events with champions to enhance champion skills and leadership. And having recognition of the team, recognition of the champions is very important. So one way to recognize is these t-shirts. We also rebranded, created a logo, make it special. So that's our logo right now. It incorporates BPSO and Humber. And this is the front, this is the back. Every champion after training, they get this t-shirt. And it's really, you can see the change behavior that's happening right now. Before, it's the CPL manager approaching the staff, the champion, if they want to become a champion, if they want to do this workshop or event. Now, after a champion would wear this t-shirt on the unit, another potential champion or staff would see this t-shirt, scan the QR code, and see the video. That QR code is the video, and see what BPSO is and what champion is. And now they're coming to the CPL as the manager, to myself, and say, I want to be trained, I want to be a champion. So you see the change behaviors happening. This is just examples of the external events. So another way to really disseminate, work collaboratively with everyone, and external events is the Smith & Nephew. They're our vendor for our wound and skin supplies, but working with them, they provided a dinner event for us, and we used that dinner event to have champions come learn more about best practices on wound and skin and the equipment. So it's a joint effort. And this was a great event. Like I said, we had another BPSO workshop. It's usually supposed to be annual, but because the May one was so good, well received, that we created a second one. Another form of recognition is after they get trained. This is an example of a poster that we posted on the communication board. So each unit has champions, and once they're trained, they get a photo on this poster, and it's posted in the communication board beside the team leader or the desk nursing station. And it's useful because family, patients also see that, oh, these are champions. And also great reminders for colleagues to say, oh, if I have a question on certain best practice or certain things, I can reach out to these people, these champions, and help with the team leaders as well. So the team leaders is not the only person that has the answer. We have champions here too. And each champion do get a certificate after they're trained at Humber River Hospital, the BPSO workshop. Another form of little game or little competition is after each champion attend an event, either an external event, a BPSO workshop, or the RNAO webinar, they have an option to use this sharing form. And this form just helps them remember what the event was, what topics were discussed, and what they would like to share with their team. So that when they're ready, they reach out to me and I go with them to the huddle. They do like a 5-minute presentation on what they've learned. It's always important to share your knowledge. And once they finish that presentation, they get a t-shirt. But if they already have a t-shirt, they get a polo shirt, which is this. And we also have a vest as well and other gifts. So it helps with positive reinforcement. This is a video. If we have time, we'll come back to this video. It's just a high level of the BPSO workshop that was done on May 20 in May. This is just, I just want to take this opportunity to thank the Humber River Hospital leadership team. It's collaborative work, like I keep mentioning, and without them, this would not happen. And this is the wound and skin events that I was mentioning. We had a nice dinner and presentation, talked about wounds. And then this is the second BPSO workshop that happened at Humber River Hospital. And just to tie everything up with evidence-based, everything I just talked about today is basically I used the GBI model, which is Jonah Bridge Institute. It's a model for evidence-based healthcare implementation. This model is very useful because it helps with understanding organization readiness, facilitating change, understanding what drives, looking at different pillars like culture, collaboration, understand what drives each pillar, and then also evaluation of outcomes. So if there is a negative outcome, this model actually helps address how can you improve, which items can you look at to improve that outcome. So I use this model throughout my whole implementation, as well as a social knowledge to action framework as well. And that is it for me. I'm open to questions. I see there's questions.
Thank you, Jen. We do have quite a bit of questions in the chat. Are you okay if I share a link to the video? I see there's a link to the video Twitter. Are you okay if I share that in the chat?
Yeah, of course.
Thank you so much. And again, thank you again for such a brilliant presentation on building and sustaining best practices. And I want to thank you for taking us through the steps of building and sustaining the best practices within Humber River Hospital from the start of your journey in 2018 throughout COVID until today. And again, I want to thank you again about how you engage champions by focusing on their motivation. And I'm sure there are a lot of organizations and leaders who would find your presentation helpful. So I guess this time we can take some questions from the audience. So one of the first questions I've had from the chat is that, have physicians been involved in the BPG gap analysis and implementation at Humber River Hospital? What are your tips on effectively involving the physicians?
Good question, because when it comes to physicians, they're special. So yes, they have been involved, but certain ones. For example, the corporate level ones. So we have corporate levels, we have falls, that's corporate. Pressure injuries, more corporate. Pain, but the specialty ones, which we're working on right now, are 7 best practices breastfeeding right now, and that's very specialized. We do have OB physicians there, they do come, but it's more of a need basis. So if, let's say we've done the gap analysis, but then there's some areas we're like, okay, I think it's better if we have a physician involved or physician intake, then we take it to a physician. And within your unit or within your department, you would know which physician to ask, which one is the most expert or most wanting to be involved. And they're very willing to, especially if it's not a lot of work for them and it's a specific question. So what I did was we do our gap analysis, determine which specific question we want the physician intake on, and approach that physician.
Cool, thank you, Jen. And I have another question. Have your champions benefited from Humber River Hospital being involved with the BPSO OHG initiative together with other organizations in Northwestern Toronto?
Okay, yes. So I am the chair of the BPSO OHC Northwest Toronto, and it has been very hard to get champions from one organization to work with champions from another organization. So how I do it is right now we are implementing falls or substance abuse as our second best practice guide for OHT. And within each organization, we use our champions to implement that. But cross involvement, our cross involvement is very high level. We're working right now on creating a champion video where our partner organization can share that video to motivate champions within their organization. That's the most collaborative work we've been doing. And hopefully, eventually, we will be able to do an in-person training for champions for different partners in person. And that's another way for other champions to meet each other from another organization.
Thanks, Jen. And do you foresee any benefits for the champions from being involved with the OHG initiative?
Yes, I think it's very beneficial because champions right now, they don't really know much about OHT, because I do present a little bit about that to them, but getting more social networking and understanding what other organization does is very beneficial for a champion.
Thanks, Jen. I just want to share a comment from East Toronto Health Partners saying, amazing video, fantastic work. Thanks so much for sharing.
Oh, thanks.
And I have another question for you. What support do you get from RNAO to implement this?
So implement all my best practice guide, I'm assuming.
Yeah, I think, yeah.
Yeah. So over a high level, RNAO is very supportive, actually. They're very approachable. What I use RNA for is understanding that contract, that deliverable, understanding what exactly are they looking for from an organization that's trying to get the title. Then I try to link what RNAO wants and then link it to our strategic plan at Humber River Hospital. Try to see, and it always links because RNAO is always about quadruple aim, and almost every healthcare organization is always about quadruple aim and being a high reliable hospital. So that's easy. So RNAO is very useful. It's getting the support and also having let's say you want pins, because it's always about engaging champions as well. Like you want pins for your champions, like after they get trained, you want them to have a pin. RNAO is very good for that too, in that aspect, giving you resources. And also RNAO is useful to link you up with another organization if you want. Like, for example, if you're like, oh, I'm very new at this role as a BPSO lead at this organization, can I get support and talk to another lead from another organization? They're helpful with that too, mentoring.
Thanks, Jen. And another question I have is, do you have any ideas on how to translate this model to a small rural Northern Ontario hospital? You have a great system and team. How do we do this with a limited employee group?
Yes, okay. I find it actually harder in a bigger organization, because in a bigger organization, there's so many things going on and everyone's always busy, right? So how smaller organization, you have a small group, but that group is you're familiar with each other. You are easy to share that information with each other and gain motivation. And how you get that motivation is actually understand, like I said, understanding really why are we implementing, why do we want to be a BPSO designate for this organization? What will come out of it? If you could answer that question, that's how you motivate your team. Once you motivate that team, and it's better to have a meeting or a small group than a big group. Because with a big group, sometimes you'll notice that nothing really happens. You just talk. But with a small group, you can make initiatives and implement them much better. I hope that answered that question.
Thank you, Jennifer. I also got a comment that your presentation was very impressive.
Oh, thank you.
So thank you so much, everybody. So I think we're at time. So if you have, if you have further questions, you can email Jennifer at jhrhsca. Put it in the chat.
Yeah.
So we've had such an engaging discussion today. And as we prepare to wrap up for today's webinar, I would like to thank everyone for taking the time out of your day to take part in this webinar. So for those of you who are participating in this live webinar today, you will soon receive a link to an online survey to evaluate today's presentation. So after you have done this evaluation, you will receive the certificate of attendance. In addition, please let us know if you have any ideas for such as a topic that you would like us to work on. So please know that this work is funded by the Government of Ontario. So again, thank you so much everyone for joining us today. Thank you again, Jennifer, and do enjoy the rest of your day. Thank you, everyone.
Bye. Happy holidays.
Happy holidays, everyone. Take care.